Hi everyone, it's Dr. Campbell. Welcome to another ICD-10 CM Coding Guideline Review session. We are still climbing our way through our chapter-specific guidelines today. We're going to focus on Chapter 13, which are the diseases of the musculoskeletal system and connective tissue, code family M00 through M99. First thing you should know is that most of the codes, not all, but most of the codes in Chapter 13 have a site and laterality designation. The site represents the bone, joint, or muscle that's involved. For some conditions, when there is more than one bone, joint, or muscle that's involved, such as in the case of osteoarthritis, there is a multiple sites code available. However, for categories when there is no multiple site code that is provided and more than one bone, joint, or muscle is involved, multiple codes should be used to indicate those different sites that are involved. Now, bone versus the joint. For certain conditions, the bone may be affected at the upper or lower end. Though the portion of the bone affected may be at the joint, the site designation will be the bone and not the joint. Next up, acute traumatic versus chronic or recurrent conditions. So guys, here we're talking about, am I reporting from Chapter 13, which is what we're talking about now, or Chapter 19, which we'll get to soon? So many musculoskeletal conditions are the result of a previous injury or trauma to that site, or guys, are just simply recurrent conditions. Bone, joint, or muscle conditions that are a result of a healed, there's that word again, remember that from the last review? Healed injury are usually found in Chapter 13, which is what we're talking about now. But if the patient has an acute injury, those are actually coded to Chapter 19. So Chapter 13, you got your chronic conditions, your recurrent conditions. If it's difficult to determine from the documentation which condition your patient actually has, it's always best to query the provider, only if you can't tell the difference between the two. All right, in this area, we also have pathologic fractures. Pathologic fractures generally have a 7th character designation. And you guys know we talked about 7th character designations when we talked about Section 1A. Remember that from a long time ago? If you forgot, go back and listen to that. The 7th character designation. So we have two that I want to talk about. First, the 7th character A. This particular 7th character is utilized as long as the patient is receiving active treatment for the fracture. Key word, guys, active treatment. While the patient may be seen by a new or different provider over the course of the treatment for this pathological fracture, assignment of the 7th character is based upon, what word, guys? Yes, active treatment, and not whether the provider is seeing the patient for the first time. And guys, you should be very clear on what a pathologic fracture is. It is a fracture that is caused by a disease process. Now, 7th character D is for those encounters after the patient has completed active treatment and is receiving routine care for the fracture during the healing or recovery phase. The other 7th characters listed under each subcategory in your tabular list are to be used for subsequent encounters if the patient has treatment of problems associated with the healing process. Some examples are malunion, non-unions, and then the sequela. Lastly, complications. Care for complications of surgical treatment for fracture repairs during the healing or recovery phase should be coded with the appropriate complication codes. Our last area here for section 13 is for osteoporosis. So osteoporosis is a systemic condition, meaning that all of the bones of the musculoskeletal system are affected. Therefore, in category M81, a site component is not an option. The site component codes fall under category M80. So M81, osteoporosis without occurrent pathologic fracture. M80, osteoporosis with occurrent pathological fracture. And those codes are going to identify the site of the fracture and not the osteoporosis. So in addition to M81, again, osteoporosis without a pathological fracture, you could have a patient that has a personal history of an osteoporotic fracture, and in those cases, you should assign a code from family Z87.310, which is a personal history of osteoporosis. So in this condition or this situation, you're going to have two codes. One that says osteoporosis without a pathological fracture, and then personal history. Lastly, osteoporosis with a pathological fracture. We already stated this is coded to category M80 because it's going to identify that specific site. Now, the code from M80 is not a traumatic fracture code. That's chapter 19. These should be used for any patient that is known to have osteoporosis and they suffer a fracture. Even if the patient had a minor fall or trauma, if that fall or trauma would not usually break a normal healthy bone, because remember, what's our definition of osteoporosis? That is, all of the bones of the musculoskeletal system are affected because it is systemic. All right, guys, that has been your chapter 13, ICD-10 CM code specific guidelines. Happy coding!